Good morning, everybody. This is the Anchorage COVID-19 operational update for August 4th. All right, go into situation overview. Go ahead.
Good morning. Today is day 519 of our response. As currently reported, locally, we're up 854 cases in the last week, 5 deaths and 17 hospitalizations. And statewide, up 1,971 cases, 7 deaths, and 37 hospitalizations. Next slide. For 213 resource requests, we've filled or otherwise satisfied 1,797, an additional 2 since the last report, with 5 currently working. Next slide. In the Sullivan, we've got 319 clients, up 8. In the non-congregate shelters, 389 clients, up 11. That's 708 clients in all shelters, up 19, averaging 2,124 meals served per day. Next slide. In the last 7 days, at the visit testing sites, there were 5,182 sample collections performed. And in the last 7 days, at all pods, 642 doses administered, with 82,516 to date. End report.
All right, thank you. Weather, go ahead.
Good morning, everyone. It's Michael Katz, National Weather Service out at Sand Lake. Basically looking at a little bit of a mixed bag for today with some sunny breaks, but a chance for some showers later on this afternoon and evening. Tomorrow, the best day of the week, and then increasing cloudiness and chances for rain from Friday through the weekend as our next weather system approaches our local area. That concludes my briefing. Any questions?
Thank you, Weather. Testing, vaccinations, go ahead.
Morning, everyone. This is Pat Ryder, Emerging Infectious Diseases Assistant Program Manager. With testing, Visit Healthcare noticed the following over the past 7 days. We've had a 31% increase in sample collections from community sites and priority populations, a 41% increase in sample collections at the community testing locations, and our testing frequency for priority populations has increased this week. Our community cases are continuing to increase. As of August 3rd, our estimated daily growth rate is 5.18%, and cases are predicted to double in just over 13 days. Our 14-day average reproductive rate is 1.212. A reminder that a reproductive rate above 1 indicates that the virus is continuing to spread. And our 14-day average case rate is 32 for every 100,000 residents. Our current alert level is high. This indicates that there is widespread community transmission with many undetected cases. With vaccines, Visit Healthcare clinics had an increase in their average daily vaccinations of 34.15% from the previous week. We have a few upcoming pop-up vaccine clinics. Today, we have the APD Chief Celebration at the Anchorage Museum. These hours will be from 4:30 to 8:30 p.m. On Saturday and Sunday, we have the Fifth Avenue Mall from 12 to 4 p.m. And on Sunday and Tuesday, we have the Lusac Library. Those Sunday hours will be from 1 to 5 p.m. And on Tuesday, those hours will be from 10 a.m. to 2 p.m. An announcement that the Fairweather location at the Tacotinu Commons will be moving next door from the former Pier 1 to the Men's Warehouse tomorrow. Finally, just a reminder, our mobile vaccine clinics can come to you wherever you are, be it a church, business, or other organization. For more information or to schedule, please dial 907-531-5100. This concludes testing and vaccines, barring any questions. End of report.
Thank you, testing and vaccines. Contract logistics, go ahead.
Good morning, this is Wendy Reese, Contract and Logistics Lead, reporting. For our testing contract, it is currently extended through August the 25th. Our vaccinations contract is extended through October the 31st. Mass care contracts are extended through September the 30th, except for the shelter management beans is extended through 9/15. Logistics, 5 resource are ready for order status, filled 2 within the last week. All personnel contracts are extended through September the 30th. End of report.
Thank you, Contracts and Logistics. Finance, go ahead.
Good morning. As of today, our encumbrances are at $20,002,896 with an actual spent to date of $69,955,816 for a total of $89,958,712. We are currently seeking cost recovery for expenses by the way of federal funding, and please continue submitting invoices and supporting documentation to eocinvoices@anchorageak.gov. End of report.
Thank you, Finance. And Safety has a video for us. And to be noted, there is no sound. That concludes Safety's slide. Public information, go ahead.
Good morning, everyone. This is Public Information Officer Heather Orono. I wanted to remind anyone who is interested in keeping track of information that we're putting out. We have our social media accounts posted at the top of the slide here. I wanted to let you know about an event coming up next Saturday on August 14th. This is a backpack and supply giveaway carnival that we are partnering with various organizations around the city. There will be school supplies handed out to registered ASD students. And we will also be using this as an opportunity to encourage everyone in the family who is 12 and older to go ahead and get vaccinated. There will be a vaccination clinic right next to this event. And if you haven't taken the time to get vaccinated, this is a great opportunity. It's a good event. We'll have more information posted up through social media soon, but just want to let everyone know that that's coming up. We are also working on compiling some COVID-19 myth-busting facts. You can see the GIF in action over on the right there. This is a series that's being put together through the Anchorage Health Department, and we are just trying to make sure that we're addressing concerns and some of the misinformation that is out there, but also just to help people feel a little bit more empowered to make the choice to get vaccinated. So keep an eye out for more of those. Feel free to share them when you see them. Help us get more solid information out into the world. We are also reviewing the CDC's Social Vulnerability Index to find areas in our city that might need more focus in terms of messaging and access. Continuing also our daily outreach to the community and media members about vaccination clinics and testing, and always continuing our research on sharing the latest information so that we're getting the best information out there to the public. Next slide, please. I'm going to kick this over to Public Information Officer Laura Atwood to tell you a little bit about this image and how it's being used.
Good morning, everybody. So I had the opportunity to work with Mass Care on a campaign to try to get more people in the congregate and non-congregate shelters vaccinated. So we did a couple different things, one of which was securing incentives for the vaccination clinics. So a big shout out to People Mover, who donated 50 one-week bus passes. And I know that 20 of those have already been given away at the clinic held at the Alex earlier this week. So that was awesome. And we are also partnering with Conquer COVID to get some Subway gift cards. So we are waiting on that status, and hopefully we'll know about that in the next few weeks. The other part of the campaign was We created one flyer that can be used as a template for upcoming vaccination clinics at congregate or non-congregate shelters. And then also this flyer, obviously it's shaped a little differently here for the PowerPoint slide, but it's an 8 by 10 flyer that can be used just anywhere at the shelters to encourage people to get vaccinated. One thing that we wanted to stress in this is that you're not just getting vaccinated for yourself, you're getting vaccinated for your family, for your friends, for the people who you love. And we wanted faces of people from the shelters, from the congregate or non-congregate shelters. So this family was willing to be part of the campaign, and you can see dad and grandmother there, and they're both vaccinated. And when I asked them why they chose to get vaccinated, they both told me they got vaccinated for daughter and granddaughter. So that's what we chose to go with, and hopefully it will encourage other people to do the same. Thank you.
And that's the end of the report for public information.
Thank you. Liaison, go ahead.
Good morning. This is Drielle Welch, OEM COVID support leader, filling in as liaison currently. So thanks to all of our partners who were able to join us today. Do we have any cooperators that would like to report out?
Hi, Drielle. This is Ashley from Anchorage School District. I'd like to report if possible.
Sure, absolutely. Go ahead, Ashley.
Thank you. So we had our board meeting last night to discuss our school start plans. And I'm going to put a link in the chat box to the mitigation measures that will be in place for the fall. We're currently working with our contract. We're changing it from Capstone to Beacon for both testing and vaccinations. So our testing sites are closed right now, but we're hoping that they'll be open later this week. And other than that, we're just getting prepared and ready for the return of students on the 17th of this month. Thank you.
Thank you, Ashley. Are there any other cooperators that would like to report?
This is Ron Swartz from UAA.
Go ahead, Ron.
So we have a decree from the president. All 16 campuses across the state are now under a mandatory mask order for anyone inside our buildings. We have a requirement in the residence complex here in Anchorage campus that people show proof of vaccine. And we're doing case management for about a half dozen breakthrough cases of employees that are working on our campus here in Anchorage who contracted COVID despite being vaccinated. End of report.
Thank you, Ron, for that report. Is there anyone else? All right, so next slide, please. We'll get started with our hospitals. Kirsten or ANMC, are you on?
Hi, this is Lori Olson filling in as ANMC liaison. Currently, we have 20 COVID inpatients, 5 ICU, 1 BiPAP, 4 intubated. We are currently on recovery for ED. We are closed to peds. And I think that's all I have to report for today. Also closed to PICU. End of report.
Thank you. Alaska Regional.
Good morning. Can you hear me?
Yes.
All right. Good morning. Alaska Regional Hospital currently has 20 COVID positive patients, 5 in the ICU, 5 on vent.
Thank you. And Providence.
Good morning. Today we have 23 COVID positive patients, 3 in ICU, 3 on mechanical ventilation, 9 COVID recovered, and 2 PUIs. And I saw the chat was asking about ICU beds available, and I will have to follow up on that one. I'm not sure. Thank you.
Thank you. Is any Matsu?
Good morning, Kara Cahill from Metz Regional Medical Center. Currently have 10 positive inpatients. 2 are in the ICU with 1 of those on a vent. Thank you.
Thank you. Is anyone on from 673rd? Okay, we will work to continue to try to get those updated vaccination numbers from the 673rd. That's all for liaison. Thank you.
Thank you, ma'am. And as of note, starting next week, August 12th, we will be conducting this 10 a.m. on Thursdays from here on out. Again, starting next week, Thursdays at 10 a.m. Everybody have a great day and stay safe.